I'm going to chat through a design research project called Healthy Voices that I did as part of my master's degree, and it was supported by Dr. Bridie Howie, who is a consultant in NHS Highland Sexual Health. So we'll be focusing on, similar to Elizabeth, the discovery phase of the double diamond. So before I start, I just thought it'd be good to introduce myself. So I studied product design at Glasgow School of Art and I graduated in 2020. And before this, I trained as a dental assistant. So I was unsure after school whether I wanted to become a hygienist or not. So I did a little bit of work experience before uni and then ultimately decided to go to art school instead. But coming from that background of working in a healthcare setting, I really wanted to use my design platform to do something good. And when I was studying my undergraduate degree, I worked on a lot of healthcare projects. So the one in the first image, the Little Smilers Club, was actually a project about teaching young children how to brush their teeth through art therapy. So it was good to kind of bring that experience into my design work as well. And then after I graduated from product design, I decided to study the Masters Design for Healthcare at de-stigmatise, which I graduated from in November. And during this time, I became really interested in user research and finding creative ways to gather and present research. So for my semester 3, I led my own research project with NHS Highland Sexual Health, and that's what I'm going to chat through today. So I know I've already spoke about this already, but just to kind of reiterate, user research or design research, which it can also be called, is basically the part of the design process where you go out and speak to users and gather feedback. And it's an umbrella term for a range of different research methods, which can include interviews, sending out surveys, running design workshops or focus groups, and doing usability testing for prototyping products and services. But user research is so important. If we don't spend time with our users to understand them and their needs, then how would we even know what to create in the first place? And how would we know how to improve existing services? And a really important aspect of user research is storytelling. So just giving your users a platform to tell their story can be so powerful when you're trying to influence change in an organisation. So for example, here's someone's first-hand experience, this is the impact it's had, and this is why it needs to change. And obviously the more users you speak to, the more patterns start to form, and you can kind of start to understand how people experience your service. And it's not just about thinking what things we can improve on, it's about understanding what we do really well that works for users. So to introduce my project, the overall aim was to use a variety of research methods to destigmatise conversations about sexual health and better understand different patient experiences. And I wanted to use these insights to promote positive change to create a more sustainable and patient-centred sexual health service. The project was only 12 weeks. So I really wanted to think of small changes which I could implement right away and then map out the long-term goals as well. So the first stage was to go on a field visit to the clinic in Inverness. And through this, I used 3 different research methods, including the mystery shopper experience, which I will chat more about in a second, observations and 6 staff interviews. And I really like to immerse myself in my research if I can. And I'd read a little bit about the mystery shopper experience method and I really wanted to try it. I think coming from a design background, it was important that I could understand how a service works in healthcare. And the only way to kind of describe it is like the show Undercover Boss. So I was basically being like an undercover patient in the service. And I was granted permission by Bridie to do this, so it was ethically approved. But it was really beneficial to experience it firsthand, and it gave me some really good insights and allowed me to create a really in-depth user journey so I could understand the service. So before I went in, I decided to create a persona for the mystery patient. And something which I think needs a lot more awareness in sexual health clinics is that they don't just offer STI tests and contraception. They offer a lot more services, especially for women's health like menopause, thrush or BV. And these type of services are not offered on the online booking system, which I had already tested with 3 users and created a separate report for. So I kind of wanted to test it over the phone process as well. So the persona had symptoms of thrush, had used over-the-counter medications which weren't working, it had an impact on her sex life and relationships which were affecting her emotionally, and the GP couldn't find the root cause. And after the visit, I created a really long patient journey with lots of different components, but I had broken this into the main points and improvements that had been made since. So the first one was the over-the-phone booking process. I think it took me maybe 6 phone calls to actually get an appointment booked. There were specific times a day we had to call, which I missed because I was at uni. And when I eventually got through and explained my symptoms, I was told to call back in the morning, where I had to explain my symptoms again. And then I was told that someone would call me back to put me through to the triage line. So by that time, I just felt exhausted. So I discussed this with Bridie, and at her next meeting, she brought it up with the team, and they decided to change the triage line to the rapid access clinic. So it felt like the phone call was an actual appointment, and it feels a lot more positive than the triage line. The second pain point was something that was so simple. It was just really difficult trying to locate the clinic. So the signage was quite poor, and they were in a porta cabin, which was separate from the hospital, but there was lots of porta cabins, so it's quite hard to find. But Google Maps kept taking me to the main reception of the hospital. So after this, the clinic was added to Google Maps, and I had a lot of positive feedback, which was good. And finally, during my appointment, I had to provide a urine sample, and this was probably the biggest pain point for me. So when I was asked to provide a urine sample, I was handed this little tub, which you can see in the first picture. And it's the kind of tub that you get sauce in for a takeaway. That's the only way I know how to describe it. And I felt quite embarrassed. It felt a little bit dehumanising, and there were no instructions in the toilet, so I had no idea how much I was supposed to fill it up, and it was quite messy. And even talking about this now is obviously quite awkward, but that is part of the problem. And I had to walk across the hall with this. I don't know if you can see in the second photo, but there's a window on the door which looks onto reception, and that's where the toilet is. So I was worried that people might see me. It was just quite an unpleasant experience, but I became really interested in this and why these products are being given to patients. My first thought was it can obviously be due to cuts in funding, and I do completely understand the stress that the NHS is under at the moment. So it's almost kind of like, is this what it's come to? And I did really feel for the staff because they couldn't have been more pleasant or more attentive, but my experience was impacted because of the resources that were available, which is completely out with their control. But also the little kind of cylinder urine sample tubes that you get, why have they been used for so many years, but they also kind of don't feel fit for purpose? So I was interested in also seeing what the testing experience was like in other sexual health clinics to see if there were any similarities or if there was anything that we could learn from them. And I went on a visit to Ninewell Sexual Health Clinic, and myself and Dr. Sarah Allstaff went through the testing experience together. And we learned so much just by walking through that patient journey together. And the key takeaways were, the first one was that they had to put a cleaning schedule in place for the hatch. So the hatch is great. It allows patients to obviously pass on their samples discreetly. However, there is a concern for cross-contamination. And in one of the conversations that we had, Dr. Allstaff came across an article on BASH, which explains an outbreak of false positive gonorrhea tests that had been caused by contaminated surfaces, which is obviously not great. So just having this cleaning schedule in place would prevent that from happening. The second one was that we realised there was nowhere for patients to put their urine samples. So if a patient was given a swab and urine test to do, they would probably place it on the bin, which you can see in the third picture. And I actually asked someone about this who uses the service, and they said that they did use a bin and they hadn't even thought too much about it until we spoke about it. So it's obviously not very hygienic. And it might be good to put like a shelf in place and then have some wipes and ask patients to wipe down after every use. And the third one was there was a lot of posters in the toilet, and when people are presented with too much information, it can be really overwhelming. A lot of really important information can be lost. But what was really good was they had instructions of how to give a throat swab or a rectal swab, but they didn't have any for a urine sample. So we thought it might be a good idea to have one for that, to show where you need to give a first stream and when you need to give a midstream. And the last one was something that Dr. Allstaff just mentioned that really stuck with me. So she said the toilet is a patient's safe space, especially within a sexual health clinic. It's one space where they're truly alone, where they feel comfortable, especially if they're coming with someone else. And I just really like this quote. So because I was using the mystery shopper experience method, I was aware that my research could be influenced by my own opinions and unconscious bias. So I decided to follow this up with interviews around the subject with a diverse group of 9 participants. And the users gave me such good feedback, and I also brought a collection of the different products with me to help stimulate conversation. So issues that were brought up were about the size of the tubes. For both women and men, it created such a mess. Some men actually expressed it could be quite painful sometimes. There was one male user who goes for testing regularly, and he explained that one time he missed and urinated down the side, and the sticker ended up peeling off, and he was really embarrassed. So now he has this routine that he goes in, he wraps toilet roll around every time to prevent this from happening. And everyone just felt that the tub and the cup were extremely dehumanising. They couldn't believe it was actually being used. There was fear of splashback and visibility. And a police officer that I interviewed made a really good point where she mentioned that using items that we use in our daily life could be a trigger for someone. So, for example, if someone had come in and suffered a traumatic experience and got an STI test afterwards, if they see this item in their normal day-to-day life, it could really affect them. So after the interviews, I asked all my users, have you ever spoken about these issues before to staff? And 8 or 9 people said no. So I asked them why this was, and there were 2 main reasons. The first one being due to stigma. So most people felt embarrassed openly talking about giving a sample in the first place. And they also felt uncomfortable being in sexual health clinics anyway. So essentially they just kind of wanted to get in and get out. Secondly, a lot of patients didn't feel that they had a say in their healthcare. And this made me think about what other issues could patients be facing in sexual health clinics that they're too embarrassed to talk about. And I kind of went back to this quote that I really liked that Sarah Olstaff said about the toilet being a patient's safe space. And it made me think of the concept of the toilet being a space where you kind of feel like part of a community, especially within the female one. So there's been so many times I've been in a public toilet that some random strangers came up and gave me a pep talk or life advice or let me borrow their makeup. And it still applies even when you're alone. You still have this sense of community with writing on the walls. People have conversations with each other and sending positive messages. And in the second one, it shows that it's also a safe space to express yourself. So kind of a place to tell your deepest, darkest secrets, get something off your chest without the fear of judgment because you're remaining anonymous. And I also really liked the project by a German architecture firm called A Tribute to the Toilet Wall Scribblers that invited staff and clients to write in the toilet walls of ideas how to design the room. And I kind of thought maybe this would be like a good idea for a public engagement tool to get people to share their thoughts on sexual health services without that fear of embarrassment, but also being able to see other people's stories would really help reduce the stigma. So I set up a space like a toilet cubicle, added testing products as prompts, and also kind of to set the scene of being in a sexual health clinic. And I had prompt cards which asked users questions and asked them to use the paper which is on the toilet roll holder to write down their thoughts or stories, and stick it on the wall with the coloured tape corresponding to the theme. And there were also kind of humanist messages to create a kind of comfortable and playful atmosphere, so they felt like they could open up. And the tool was exhibited at the Degree Show, and it was also in Ninewells Hospital as well. And it included a little condom souvenir that was in a little wallet that had a QR code taking users to the Tayside clinic to order packs themselves. So as well as kind of gathering research, it was also promoting safe sex, which I thought was quite good. And I received a lot of feedback, which was amazing. As you can see in this image, that's one half of it. And there were different themes on the prompt cards, which all the feedback was separated into. So I had barriers, issues, education, and ideas. And it was great to see that there was such a good mix of feedback. Although the highest is at 33% was relating to issues faced using the service, 30% were ideas. So it kind of shows that patients aren't just complaining about the service. They're kind of like, well, this didn't work for me, but how about we do this? So it shows a kind of more encouraging and positive mindset because we're actually engaging with them and giving them the opportunity to have a say in their healthcare. And after this, I did some affinity clustering and separated them into more specific themes. And as you can see, the testing experience was spoken about a lot, but I'm guessing that's probably because of the environment that I created for them to encourage them to speak about that. But I don't have time to chat through every single one of them, although I'd love to. But some of the interesting ones were A few people explained that they had to, when they went to the clinic and get a test, they didn't actually know what they were getting tested for because it wasn't explained to them. And I had a card which spoke about women's health, and a few of the males had no idea what BV was, and some of them thought thrush was an STI. So it shows that women's health obviously needs a lot more awareness. It'd be good to make testing kits more eco-friendly and try and reduce plastic. People had problems with transport, how it'd be good to have clinics in a more central place or have mobile clinics, like example at unis, no talk testing. Clinics that cater to the 9 to 5, having weekend clinics. Someone said it'd be good to have an easier way to book in for appointments and use the McDonald's self-scan machines as a good example, which would be more discreet. And someone else said about having pods in the waiting area to sit in your own bubble. And there were also just a lot of positive messages that people would leave to each other, thanking them for telling their stories. So it showed that it actually did start to reduce the stigma, which was really nice. So yeah, that is me finished talking about my project. But just to sum up the presentation, I think that creativity can play a really important role in user research, especially within healthcare. And I'm obviously not saying we need to go out and design these wacky public engagement tools all the time, but I think we need to place importance in making user research engaging. Even if we're just sending out a survey, how can we make people want to fill this out? Or are there any ways that we can make patients feel more comfortable when they're discussing sensitive issues, or find ways to encourage marginalised groups to participate and giving feedback? And user research is obviously a great way to break down barriers. I think everyone working in NHS is under so much stress right now, so just breaking down those barriers and kind of trying to get people to unite as one could have so many benefits. But yeah, I'll open up to any discussions or questions.